Hey mamas and mamas to be, it's Miss Toni. Thanks so much for joining me on Mommy with Miss Toni. This week we're going to talk about breastfeeding. So this was a special request I got from a couple moms to be. And so today I'm going to show my top 5 tips on breastfeeding. Some of them will be simple tips for the beginner, the mom who hasn't breastfed before, and others will be a little bit more advanced if you've breastfed before or you're breastfeeding right now and you want to get over that hump and figure out some shortcuts to how to make the process a little bit easier. That's what I'm here for. So go ahead and tune in and we'll get right into it. It's an exciting time to breastfeed, but it's also a confusing time for those who haven't breastfed before because you think it's this natural thing that just innately happens when the baby comes out. And the natural part is that the baby, if you put them on your chest, the moment after they're born, they will eventually work their way over to your nipple. So there is a natural process to it all. However, as you guys might know, because you're looking at this video right now, there also can be some challenges. So sometimes the challenge comes when you're trying to get the baby to latch, and let's say the baby has a tongue tie, or let's say you just don't know how to properly get the latch yourself. You can end up with dry, cracked, sore nipples, and I've had it all. Trust me, I've had it all. And so I want to help you make the process a little bit simpler. So don't worry, I will have baby Karis join me soon. She's actually asleep right now, but I'm gonna wake her up before this video ends, just so I can demonstrate breastfeeding in real life. I don't like to talk when I'm breastfeeding, especially at this volume, because the baby gets distracted and will come off the latch. Sometimes my kids are in there and that's okay because she's gotten used to the toddlers' voices. She of course knows Kelvin's voice. But I try to keep everyone's voices low when she's nursing. And it's only because it's the early days. Eventually, we'll get to the point where she'll be able to nurse in the middle of any chaos. Like, we'll be in the car, we'll be at the park, we'll be at the mall. Like, she'll get to that point where she can do it anywhere. But these early days when, again, they're still getting adjusted to the process and they're still on demand, they're not on a schedule, then you kind of want to make it convenient for them every single time so that you can have a good experience. So my number 1 tip is to be able to anticipate when your baby is hungry. So you look for cues. You look for the baby putting their fist in their mouth. You look for the baby moving their head side to side, opening and closing their mouth. I mean, these are all cues that they are hungry. So Karis, she just wakes up hungry. The girl sleeps all day long. Thankfully, she's starting to sleep through the night as well. Praise God on high, because we needed it. The good thing is for her, we don't have her on a clock yet. I'm breastfeeding on demand, and that just means I do it whenever she's hungry. So later on, once we're more into the process, maybe when I go back to work, then we'll be on the schedule. But for these early days, you want to just breastfeed when the baby is ready. So for Karis, the moment she opens her eyes, she gets a boob in her mouth. And if I'm downstairs or I'm out running errands, then I have pumped to prepare for that, and Kelvin will give the baby a bottle the moment she wakes up. And so we don't wait for her to cry. That's the biggest thing. We know she's going to be hungry when she wakes up, even if her nap is short. So during the nighttime, she's sleeping 7-8 hours straight. And then she wakes up hungry, she'll eat, she'll play for an hour, and then she'll go right back to sleep. Then throughout the course of the day, her naps are only about an hour and a half, 2 hours. I mean, they vary. And be ready and prepared. The reason that's important, which goes to number 2, is because you need to be relaxed when you're breastfeeding. So I went to breastfeeding classes before I had my first baby. I remember at the classes, that was like their major thing. They just kept saying, you're going to want to relax. You're going to want to relax. And I was thinking, like, what is the big deal? Like, what if I'm not relaxed? Like, am I not going to be able to breastfeed just because I'm not relaxed? What if I'm busy? What if I have something else going on? I can't make a perfect setting every time. So why do they keep emphasizing this relaxation? And it's actually a very important part of breastfeeding, because if you're not relaxed, your baby will know you are not relaxed and they will not latch. And so it could be that you're doing yoga like right before it's time to nurse, or it could just be simple, just taking some deep breaths, taking a few moments. And I know it sounds like corny, like, why do I gotta deep breathe just to breastfeed? It's literally just to get your body ready. because if you're anxious, especially at the point when it's so early, and again, you might have cracked nipples, you might have a little bit of bleeding. I mean, honestly, your breasts, yes, they were designed for this, but all the years that you didn't use them for breastfeeding, and now you're all of a sudden needing to breastfeed every couple hours throughout the day, your nipples are kind of like, what is going on? And so just being used and stretched multiple times throughout the course of a day is a new thing for your breasts. And so before they get acclimated, they have to go through the ringer, unfortunately. And so if you're not properly latching, then the baby might be actually biting the edges of your areola. And I know it sounds funny because babies don't have teeth. How can they bite? Their gums are so powerful, like scary powerful. And so they literally, if they're just all day long latching the wrong way and they're not going deep enough, then if it's too shallow, meaning your nipples here and they should be all the way here, their mouth, and they're just up here doing a shallow latch, then they can hurt the area right between your nipple and your areola. I've had this happen with all three of my kids. So you're like, well, why? You should know this by now. You should have learned after your first baby. Typically, you forget a lot of stuff, to be honest. That's number one. You forget sort of how to work that latch. Number two, every baby is different. So while you're learning how to latch that baby is learning how to latch on you. And it takes synchronization, it takes a little bit of time. It doesn't just happen the moment they're born, unfortunately. And so sometimes you go through that process the first few days where you have a little bit of blood, or you have a little bit of tenderness, or even a bit of swelling. And so you just want to make sure that if you have some of those issues, that you don't let that discourage you from breastfeeding. It almost discouraged me every single time. And once I worked through it, I was able to kind of get past that hump, and then the breastfeeding became natural. So again, relaxation is important. Have your music ready, have your magazines ready, have your phone ready, like whatever it is that you're gonna be spending your focus on during that time to just de-stress, then do that. The time that you have when you actually are breastfeeding is very precious. A lot of times me and Karis, we just exchange looks throughout the process. Like, we just stare at each other's eyes, and it's just this beautiful bonding time. I mentioned position, so that's my number 3 tip. The mom's position and the baby's position, which is my number 4 tip, they're both very important. So for mom's position, you're in the hospital, you're gonna be in a hospital bed, reclined, and the baby again will find their way to your nipple. And you can always get in that position if you have a nice recliner chair, rocking chair, something like this. You can always get in that position and lay the baby on your chest and nurse that way. For me, even though I've done this 3 times around, I still use breast pillows. I love breast pillows, y'all. They're so comfortable, and you literally just put yourself in the little donut and put the baby on the pillow. So for this, I like to stack my pillows up behind my back. Oftentimes I'll do this just in my bed. So I'm sitting right parallel to my headboard. I'll have a big pillow behind me, just making sure my back stays straight. That's very important because you can get into a rhythm where you're bringing your boob to your baby all day long, and then that messes up your back. You do not want that. Lower back pain, any back pain, especially when your body is still recovering from the delivery. So I highly, highly, highly recommend, no matter if this is your first time, your 5th time breastfeeding, get a breast pillow, especially the first couple months. It's gonna be very helpful. You'll get the swing of things and you won't need it later on, but in the very beginning, I highly recommend that. So number 4, as I mentioned, is the baby's position. Now with the baby, you wanna make sure you have the baby comfortable as well. One thing that I was doing wrong with my firstborn is I would put her on the pillow and then I still would be leaning forward trying to get my breast in her mouth. And what you should be doing is bringing the baby to you. And so back straight, you got the pillow so that they can lay sideways, and then you bring them to whichever breast it is that you're going to be nursing with first, and you need to cradle their head and actually hold your breast at the same time. So this is really important. Your index finger, your thumb should be holding your breast, making sure it stays straight. And in the beginning, I actually loosen up my milk because my milk comes through really thick. And so when I first had Karis in the hospital, I had a lactation consultant come to my room, and she was like, "Oh my gosh, you're so swollen. Your breasts are so swollen. Oh my God." And she was like, "Is this your first time breastfeeding?" I was like, "No, this is my third." And she's like, "Is this normal?" I said, "Absolutely." So she went and got me some ice, and this was like maybe an hour after baby Karis was born. And so I had to ice down my breast because immediately my colostrum came in, but my boobs were just fully engorged, which just means they're super full, but they're also swollen. Thankfully, they weren't painful. A lot of times women get engorged and it does become painful. But if you can put ice on it, I take ibuprofen when I need to, as far as being able to reduce the inflammation, that swelling. And then, like I said, right before I nurse, even now, 6 weeks later, I still loosen up the milk right by my areola first, just to make sure. And then I self-express with my nipple just to get some milk already out. If there's none immediately available, then I pump first, which I mentioned that in one of my pumping videos. I know that sounds backwards because most of the time you should be pumping afterwards just to empty out your breast. I do just a little bit up front so that I can have my boobs nice and ready, hot and ready for the baby, so that she doesn't have to stress out trying to get the milk out herself, because again, that's another situation where the baby will just stop latching if it takes them too long or just too much effort to get milk to come out in the first place. So again, you're holding your breast with your 2 fingers. You have the baby's back of their neck and their back, and you bring them to your breast. You want to go bottom and then top. You go bottom because you want their bottom lip to be open and to grip the bottom of your areola, and then just lightly touch the top with their top lip. So you don't want to go top to bottom. You don't even want to go head on straight, which that's actually the more natural. You would think like, here's your breast, here's your nipple, here's the baby's mouth, let me go straight on. You want to kind of go up and then over to get their mouth all the way open. And if their mouth isn't open, then don't latch. Like, that's the tricky part, and that's the part that hurts. If their mouth is only open just a little bit and you're just trying to get them latched on, and then they just latch on with that shallow latch, that is what's painful, and that hurts every single time. And again, you're doing this every like 2 to 3 hours throughout the course of a day. So then you get to a point where you're anticipating the pain and you just don't want to do it, and then you quit. I got that close to quitting until I really realized, like, okay, I really got to work on this latch. I really got to work on getting her mouth open. And so you can put your breast on the baby's chin, almost like you're teasing them before they open up their mouth fully to get that full open O shape in their mouth. If it's just too narrow like that instead of that, again, you are going to feel it, mama. Another trick is to touch their cheek. Again, you can do that with your finger, you can do that with your nipple, or you can rub your nipple from their nose to their lip, nose to lips, just to try to get them to open up their mouth. And their chin should be right up against your breast, so that their nose has that free reign to breathe. Like, if you have really big boobs, then sometimes that's going to be a little bit more difficult. But either way, if you can get the baby to be chin up a little bit, not just straight on, but chin raised while they're latching and while they're breastfeeding the whole time, then their nose will always have that clear space, that clear airway for them to breathe. And the last thing is caring for your nipples. So I use lanolin religiously, and in the beginning I was using Aquaphor as well. Whatever you get something that's a healing balm, and then also have something that's just a soothing cream. And so that's what I do afterwards, especially that first month when I just had dry and cracked nipples. I use the Aquaphor after every feed. And that's the thing, is that you really want to try to do it quickly after you're done. For me, it's like the thought of the baby ingesting this every time was a little worrying. So what I would do is immediately after I got done breastfeeding, I would put some of this on any of the cracked areas around my nipples. And then sometimes I would just let my boobs air dry. So I'd walk around the house with no bra on for an hour, hour and a half. And then I will wash them off. You can soak them in a sitz bath with just a little bit of Epsom salt or something similar. Just a very shallow bath. Go ahead, put your boobs in briefly. You don't want to do that too often because you don't want to dry them out. But every now and then, if you need to, go ahead and do that. Otherwise, you could just pat your boobs afterwards and get them clean. And then I will go ahead and put on a little bit of the lanolin for like the next half hour. Now this one says safe for baby, 100% natural, and that's all good, but I still wipe that off right before I nurse. I would highly recommend just taking care of your breasts because your baby is using them all day long, and you just want to make sure that they stay healthy as much as you can. And again, it's okay in the very beginning, you know, the first few weeks, if you have some soreness, like tenderness, it's okay. Like, that's very natural. It's not just you. You're not necessarily doing anything wrong. It's just your body getting used to this whole new process. And then eventually, once you've been doing it for a month or so or longer, then your body has gotten accustomed to it. And then you don't have to worry about doing the Aquaphor. So I'm about 6 weeks out. I actually don't use the Aquaphor as much as I did like 2 weeks ago when I was using it all day religiously. The lanolin I still like to use a few times a day. But eventually I'll get to the point where I won't need either one of them, and I'm looking forward to that day. The last thing I want to touch on is something I mentioned earlier in this video, and that's lactation consultants. They are God's gift to boobs, I swear. I went through my insurance company and was able to find a lactation consultant in my area with one of my previous babies, and she was magnificent. I went to her multiple times because she's the one who sat down and watched me pump and told me, okay, you're doing it right. And I had never seen anyone pump before. And then she also said, okay, you have very thick and sticky milk. This is thicker and stickier than most mom's milk. And I was like, who knows that? Who would have told me that? My OBGYN is the one that I will see soon in my 6-week appointment, but I don't even think she would be the one to tell me that. And so I would highly recommend you hiring a lactation consultant just to assess your body, your situation, you and your baby. Not only do they work with you, but they'll work with the baby as well in their latch. I mentioned to you guys in a previous video that I also take lecithin, which is a supplement, and that's because a lactation consultant recommended that for me because of my thick milk. And then even like if you have an issue where the baby has stopped latching and you want to help them get relatched, not only is using the nipple shield helpful, but my lactation recommended certain things, another supplement called fenugreek, eating oatmeal, getting those yummy lactation cookies, which are delicious, and they actually do help because of the flaxseed in them. So all these things that I just didn't know, I would highly, highly recommend a lactation consultant for you too, boo. So baby Karis is here and ready to eat. Ready for some milk, mama? See, the fist in the mouth means she's ready. She's going to work.